That's why I send you my message in advance. Good morning, good afternoon, and good evening. Welcome the 1009th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a moment. Thank you. Today, our guest is Dr. Shivashanker, MD, lecturer, Department of Materia Medica, BBHMC, Bangalore. 10 years of clinical experience, and the topic is report approach in homeopathic practice. Integration of organon, materia medica, and repertoire. To arrive simile and also in follow-ups, demonstration group cases. Very important topic. And on behalf of IFPH, I welcome Dr. Guru Shivashanker. You can have a platform for next 40 minutes. So to please wait. Meanwhile, you are not the co-host. I would like to communicate with our host so that you can, then only you can share your screen. Dr. Gurukiran.
Yes, sir.
Yes, please stay with us. Due to some technical problems, please wait.
Okay, sir.
Yes, because this is the online meeting, no personal communication is there. That is when all this unfortunate thing happened. I just informed the former host and he was not listening for me for my appeal. That was just happened. Anyway, let us start. As now I shall make Dr. Gurukiran also co-host so we can share. Yes, that's right. Now please proceed, Dr. Shivashanker. Sorry for the delay. Thank you.
Yes, sir. Yes, sir. Good evening, sir. Good evening, dear doctors. Today I'm going to present one of the topic in homeopathy called tripod approach in homeopathic practice. I have been influenced by great teachers like even Dr. Tiwari sir. 5 years back, when I have been to Kulashekaram, SKHMC Homeopathic Medical College, Dr. Tiwari sir motivated me and other young doctors to go for integrated approach. At the same time, I would like to convey my thanks, or I'm also very I have gratitude towards Vitulkas, late Dr. Shivashanker. Many great teachers have influenced me. Here, what I'm trying to say is, many times when we doctors, we discuss among ourselves. Sometimes we tell that to practice homeopathy, what we require. If we have very good knowledge of materia medica, we can have a good practice. Some doctor says that the Bible of homeopathy is Boric. Boric is a fantastic book, but we have many different types of materia medica. Every materia medica has its own merit and demerit. So what I would like to say here is, we need to integrate organon, materia medica, repertoire simultaneously in our practice. Great authors of books tell that organon is brain. So organon will guide us how to take the case. The moment the patient comes with some particular problem to us, organon guides us how to observe the patient, how to take the case in aphorism 83 to 104. Once we take the case, once we understand the disease, we have to analyze, we have to classify the disease, whether it's indisposition, should I treat it or not, whether it's acute disease or chronic disease. All this is guided by organon. After completing the case, the most striking, singular, uncommon, peculiar symptoms should be taken. Okay, all the symptoms, all the major symptoms, what patient presents are not equally important. We have given the discretion which one to take, which one not to take. The uncommon, general symptoms like weakness, all these are not important. The disposition should be considered, the mental disposition. All this is guided by organon. Once we know the peculiar expression of the patient, sometimes we cannot directly find in our materia medica because we have nearly more than 154 materia medicas. Every materia medica has its own merits and demerits. But fortunately, we have very bigger repertoires like synthesis, complete. The peculiar expressions can be converted into rubrics. Then repertoire will show a group of drugs. Then we can reflect on materia medica, drugs. We can find the most closest remedy. In a nutshell to speak, organon is brain, materia medica is heart, repertoire is limbs. Many authors of books say. And we have one side patient. We have another, am I visible, sir? To audience?
Yes, yes, no problem. Please.
One side we have patient, other side we have drugs. The bridging link between patient and drugs is our repertory. So all in our practice, to establish a good practice, to cure our patients, we need integrated approach of organon, metronomic and repertory. Simultaneously, we need to use the knowledge, all these three knowledge. Now, the next slide. As all of you know very well, what is tripod? Next slide, sir. Tripod is any frame or stand which has three legs to support the weight, any weight. Generally, we mount our valuable camera on the tripod. Even if the one leg is weak, the valuable camera may fall. So tripod is a portable three-legged frame or stand used as a platform for supporting the weight or maintaining stability of some or other object. Next slide. So similarly, our homeopathic practice also has three legs: organon of medicine, materia medica, and repertory. Even if our one leg is weak, our practice may shake. If we have good knowledge of organon, good knowledge of materia medica, nobody can have good knowledge of materia medica. Sorry to tell you like this. I'm a young teacher, but materia medica is so vast. I will say even the masters also cannot master materia medica because materia medica is so vast. And when the drugs are proved on healthy human beings, different provers, different symptoms. Different prover, different symptoms. All the symptoms are conglomerated and put in our materia medica. And every drug has so many shades. We cannot have fixed idea about drugs. So again, we have to use repertory. In homeopathy, there are many instances. I should not be taken in a wrong way. There are many instances where senior homeopaths might have failed. A junior, if you use proper repertory, there is more chances a junior can also solve the case. So that's why we need to use all the three subjects very well in our practice. And one of the primitive book in our literature, Fragmenta de Viribus Medicamentorum, as all of you know very well, Hahnemann published in 1805. What is the speciality of this book? This book contains 2 volumes. The first volume contains first 8 pages about similia principle, about similia similis curantur, how to give the medicine. The 269 pages contains 27 drugs. Every drug begins with introduction, which part should be used, how the drug should be procured, how it should be prepared. Later, symptoms proved on healthy human beings. In a nutshell to speak, the first 8 pages of the first volume is organon of medicine. Every drug begins with introduction, which part should be used, nothing but pharmacy, and the symptom proved on healthy human beings, materia medica. Next slide. The second volume, the part secunda, contains 6 pages of vocabulary, which contains 61 rubrics with meaning, and 470 pages of alphabetical index to materia medica, which were published in Latin. The very first repertory was alphabetical repertory. The second volume of Fragmenta de Viribus. Here we could see one peculiarity: 269 pages of information about materia medica, 470 pages of alphabetical index to materia medica. In the very conception of homeopathy, in the very primitive stage, in 1805, repertory was bigger than materia medica. So what we need to understand, see, homeopathic pharmacy, organon of medicine, homeopathic pharmacy, materia medica, repertory, all these 4 subjects are in fact single subject. As the information became more and more, it was difficult to accommodate all the huge information in one book. That's why even Hahnemann gradually wrote organon of medicine, later theory of chronic disease, later materia medica pura, theory of chronic diseases. As the information became more and more, the subsequent masters that accommodate the huge data in different volumes, like hearing guiding symptoms 10 volumes, or Allen's Encyclopedia in 12 volumes, like this. So in fact, all these 4 subjects are single subject. We need to integrate in our practice. Many times what happens? We say homeopathy is a holistic science. We consider patient as a toto. But sometimes when we study for exams, or sometimes when we conduct exams or whatever, as a student, I'm telling, right from my student days, our sometimes our education is more compartmentalized. But the method of practice, when we go to our practice, we have to integrate, which invariably demands integration of the various branches of knowledge what we have got in our education. Next slide. Yes. Whether it's a bachelor degree doctor or master degree homeopathic doctor, every homeopath, we have mainly 3 duties, which is very clearly told. I was told. First and foremost, we have to, patient has come with particular complaints. We have to understand what is to be cured in each and every case of disease. How do I come to know what is to be cured? By the process of case taking, which is the organ and gate size. Once we took the case, again we have to classify the disease, whether it is, suppose a patient comes with mild abdominal pain, loose motion since morning 3 to 4 times. By evening, the moment he reaches your clinic, he is feeling better. We did not give any medicine. It is an indisposition. So why should we give medicine? So whether to make discretion, whether it's indiscretion or really acute disease or chronic disease, our organon helps. And one of the surprise in my practice, since a year what I observed, nearly 2/3 of the cases in my OPD or in our OPD who come for the first time for acutes. Nearly 2/3 of the cases who come for the first time for acutes, like running nose, headache, or body ache, they're requiring directly constitutional remedy because the acutes are exacerbation of the latent sora. All these many clues we get from our organon of medicine. And what is curative in medicine? That is knowledge of materia medica we get from proving drugs on healthy human beings. And once we have understood the case, we have drugs, but what to match, what not to match, to prioritize our aphorism 153, striking singular uncommon peculiar symptoms helps in determining the selection of remedy. And in 211 aphorism amendment tells this falls to such an extent the state of disposition of the patient, which is being decidedly characteristic, often chiefly determines selection of remedy, which cannot remain concealed from accurately observing physician. Here, Hanuman tried to say the mental state of disposition, patient will not tell, I am anxious. Patient has come with headache. Patient has come with bronchitis, cough. You are observing the anxiety. Patient will not tell, I am a hearty patient. We are observing. Majority of the time, the mental state of disposition has to be observed by the doctor, or sometimes revealed by the attenders. So all these clues, every word used by amendment is very important. And aphorism 5, as all of you know very well, the previous speaker told very beautifully. We cannot prescribe on single symptom. We have to prescribe for totality. We have to see the patient as a whole. Hanuman initially prescribed on common symptoms, later 1 or 2 peculiar symptoms. Gradually evolved into and whatever the disease, we have to treat the patient as a whole. As the previous speaker rightly pointed, the generals, which the generals are the expression of the patient. Whatever we see, qualified mentals, qualified physicals, the generals, they are overall reaction of the patient to the external environment, which represents a holistic reaction. All this idea we get from our organon of medicine, and whatever in after case taking, we analyze the symptoms into common and uncommon as per Ken. Again, because of aphorism 153. Again, uncommon symptoms would prioritize more qualified mentals, qualified physicals, last qualified particular, again because of 211 aphorism. In a nutshell, whatever the repertoire methods were evolved, again because of our organon of medicine. I'll be explaining few cases after 5-10 minutes. It's not a theoretical lecture. I will demonstrate with cases. Please be with me. Next slide. Yes. As all of you know very well, when aphorism, when the disease is chronic, we have to treat the patient, the moral and intellectual character, his occupation, mode of living, habits, social and domestic relation, his age, sexual function. The same aphorism, the same aphorism of 5 can be elaborated into mental generals, physical generals. In mental generals, it tells deviation in will and emotion is important, then the intellect, then the memory, then physical generals. What and all we take physical generals, appetite, thirst, sleep position, dreams, all these are nothing but all these could evolve into generals from this aphorism. Next slide. The subject is very interrelated. And many times, again, for us, the main 3 sources of symptoms are what patient tells, what attenders tell, what physician tells. This I will explain with reference to case. Next slide. Yes, this is one of the good book. I advise the young students or my dear doctors to follow. Many seniors might have gone through this book. Very good book. After reading this book, I got much clarity in my prescription. Now we'll move to cases. Yes. It was a little bit old case. Since this case is for solving, this case is serving the purpose. That's why I took this case. A 23-year-old female. She was actually interning in our college. She came at around evening at around 6:30. She came to me. She came to our OPD with printing complaints, pain in throat since the morning, bursting type of pain, occiput especially, and generalized body ache and weakness. Next slide. When I saw her, generally she was very active during daytime. Whenever I saw many times, at 6:30 when she came, she took my permission. Said, "Good evening, sir." She came and sat in front of me. "Sir, since morning I'm having headache, sir, body ache, sir." Her voice was low. This I observed. Since her sickness, she has become dull. I asked, "How is your appetite test?" She told, "Sir, since morning I have not eaten it. I have not taken anything." And she likes. I asked, "How is your thirst?" "Sir, I am drinking hot water, lukewarm water with lemon." I asked her whether you like hot water, whether you like lemon. "Sir, I like lemon. Since morning, I'm feeling like drinking lemon water. I'm feeling like that." Next slide. Here, the very important is observation. As Hahnemann mentions very clearly in aphorism 211, the state of disposition of the patient has to be observed by the doctor. Many times, Boningerson tells, whenever we make totality, acute totality, location, sensation, modality, concomitants. Boningerson mentions in his book BTPP that majority of the time, my fellow homeopaths, they elicit location, sensation, modality. Often they fail to recognize concomitants because majority of the time, concomitants has to be observed by the physician. Patient will not tell. A patient has come with headache. His face is red. He will not tell my face is red. His concern is headache, type of headache. It is a physician who is observing the redness of the face. A patient has come with headache, a tremendous anxiety, or a patient has come with headache. The moment the doctor sees the moment the patient sees the doctor, she's exaggerating. "Sir, I have severe pain." Patient is weeping. Patient will not tell that I am weeping. Patient concern is headache. Majority of the time, concomitants have to be observed by the physician. What Boningerson's mental concomitant, what Hahnemann tells, the state of disposition, the altered state of disposition of mind, what Kent says, qualified mentals, all these are almost similar concept. Here, when I observed, she was dull, her voice was low. After 2 minutes, she took my permission. What she did, she folded her legs like this, how we sit on the leg. She folded her leg, started doing motion like this. "Sir, since morning, I'm feeling like moving my body. like this. If I feel my move, if I move my body like this, I feel better, sir. So this was observed by me. What I observed, why she's moving like this? So since morning, I am. If I move like this, sir, I feel better, sir. This was a peculiar expression. For a patient, it is not a primary concern, but for a homeopath, remedy is a concern. For patient, common symptom is a concern. Next slide. Yes. When we put it to Bonegasson method of totality, the location was occiput, sensation was bursting, modality was to and fro amelioration. It's not a local modality, it's a patient as a whole. We can grand generalize. Patient as a whole is better during infection. Patient as a whole is better by to and fro motion. And the concomitant was craving for lemon. Can our doctors guess the remedy? Can I know through typing? I want some introduction. Any remedy you can think of? Yes, I will move ahead. Yes, next. I took the rubric. Here, for us to select the remedy, we have many drugs for headache. Bursting headache, we have belladonna, we have glonine, many drugs. For us, the more important is modality and concomitant. Bonegasson mentions amongst the location, sensation, modality, and concomitant, it is the modality and concomitant, which are the peculiar symptoms that determine the selection of remedy. The modality and concomitants are the key to unlock the, unlock the keys. So I took the rubric in my repertoire. Generals, rocking to and fro amelioration, belladonna and hyacinthus was there. Next slide, I took one more rubric. Desire for lemonades, belladonna was coming 2 mark. Next slide. The moment I joined the both rubrics, I got the remedy belladonna, Maxal, Sabadilla. Next slide. When I took all the symptoms like mental dullness, bursting pain, occiput pain, desire for lemonades, to and fro, the one remedy which was covering very well was belladonna. Here, if you could see common symptoms like head pain, bursting pain, occiput, many drugs are covered. Maxal, Natramur, Pulsatilla, many drugs. But the uncommon symptoms were covered by belladonna, which made me to give the remedy belladonna. At 6:45, I gave belladonna 1 ml 1 dose to her. I generally, whenever I treat acute cases, I make the patient to wait in the waiting hall for half an hour. Once patient feels better, then I send the home. This is my method of practice. I told her, just you wait here. She told my room is in front of the hospital, sir. I will go and take a rest. For a few minutes, I will come back. She came to me at around 7:45, around 7:50. She came and told, when she came for the follow-up, after taking rest, sir, I'm feeling 80% better. Still, I'm feeling like moving my body. Still, sir, I told what happened after taking the medicine. Sir, I took the medicine powder, 1 ml 1 dose, belladonna 1 ml 1 dose. I went room. I felt sleeping. I felt like sleeping, sir. I slept for nearly for half an hour to 40 minutes. After waking from sleep, she asked for the, she was hungry. She asked for, idli, 2 idli. Her roommate brought the idli from neighbor, from the nearby hotel. She ate the idli. At around 7:50, she had come to me. Here, after giving the right remedy, the sign of improvement, Hanuman tells in the Aphorism 253, sign of improvement should begin in the holistic level. After right remedy, their energy level should improve. They should get higher spirit. The demeanor, and the demeanor is certainly instructive. Next slide. She was doing excellently well after right remedy. Just a sec. Yes. In the aphorism, 253 such as of an acute nature, sometimes the aggravation or amelioration of complaint may not be easily perceptible. The state of mind, the whole demeanor of the patient is certainly instructive. After a right remedy, patient feels a sense of well-being, higher spirit, increased calmness of mind, we can come to know patient is doing well. That I told her wait till tomorrow morning, and next day she was all right. Now one more, her friend who was accompanying her, she told at around 7:50, sir, I too also have got throat pain and body. 3 years back case before COVID. Okay, I too also have pain throat since morning, sir. I asked why you did not tell that time 1 hour back. So that time 1 hour back it was less. I thought it will go off by itself. Now complaint is more, sir. Fine. So I too also have pain throat in morning since morning. It is our friend. Muscular pain all over the body. She told, sir, I'm getting heaviness of the head, sir. My whole body is, I'm feeling heaviness. Sir, if I do slightest motion, my headache is more. She told like this. I asked, have your appetite is less, sir? I'm also not feeling like eating anything. She has also become dull. Just I was observing her. What she did after 2 to 3 minutes, started doing like this. This I observed. I told, why are you wetting your lips? Sir, I'm feeling dryness of lip. I'm feeling dryness of lips since afternoon. I told, open your tongue. Tongue was dry. She was feeling like drinking water. For me, the remedy was very clear, as all of you could guess the remedy. Next slide. Location, forehead, muscles, generalized body ache, heaviness, slightest motion aggravation, concomitant. Here, what I observed, patient did not tell. When I observed and asked, then she told. So concomitant have to be observed by the doctor. Many times what happens, I observed when I was student, I also did many mistakes. My friends also did many mistakes. Now sometimes students, of course we learn from mistakes. There's nothing wrong in doing mistakes, but we need to learn from our mistakes. Many times we'll be very busy in writing. Oh, you have got a headache. Where is the headache? We observe less. What I advise you here to my dear doctors is, but listen to patient for 5 minutes. Understand. Once you understand where is the headache, when it is more, see the patient, observe the patient well, understand, keep the data in your temporary memory, then write down. Do not immediately start writing. This is my earnest appeal. We took the rubric. The remedy was very clear, bryonia. I gave bryonia 201 dose. By next day she was all right. Here the question is, I asked how it happened. 1 day before they had some leave. They had been outside. There were change of weather. They had gone outside. Okay, they had eaten ice cream, or they had gone outside. They had exposure to cold weather. Now the question is here: after exposure to cold weather, after eating ice cream, after doing party, if somebody gets disease, both of them are requiring different medicines. One of the great homeopath, Dr. T.S. Iyer, mentions that prescription done on the basis of cause alone, only on the basis of change of weather or on eating ice cream, only on the basis of cause alone is a blind prescription. To the cause, how does one react is very, very important. It is often the modality. In this case, one girl is telling, sir, I'm feeling better by to and fro motion. Another is telling, sir, slightest motion aggravates. See the peculiarity. It is always the modalities and concomitants individualize the case of disease. Our focus should be on the unique expression of the patient rather than the cause. Many times I have seen, certain children after vaccination they develop fever. Many times during fever, the child might be weeping, moaning. We have given remedies like calcitilla, they are doing excellently well. Again, the totality of symptom is important. Cause is not important. Because majority of the ailment from in our Metro Medica, what Clark mentions in our repertory test come because of clinical verification. So far as we can add few more drugs. The section is not a complete section. So that's why we need to use our discretion. If you do not use discretion, if you blindly follow, we may not succeed enough, which I was doing earlier in my earlier days of practice. I'm also learning, I'm also evolving. Next slide. Yes. Kent mentions in his book what a doctor need to know in order to make a successful prescription. In any given disease, Kent says whenever you take a case, in any, you get a disease. Yes, in a particular disease, patients who are suffering from bronchitis, patients who are suffering from fever, we see a common group of symptoms almost in everybody. These are common symptoms, helps in diagnosis of disease. But on the contrary, in every given disease, there is another class of symptoms peculiar to the individual, differing in some way from those of other cases of the same disease, in modality and concomitant. These symptoms show the individual characteristics of the patient, point unerringly to the curative homeopathic remedy. When these symptoms peculiar to the individual patient are known, homeopathic remedy can be selected that will surely cure every curable disease, whether disease is tumor, morbid growth, cancer, skin disease, any form of chronic or acute disease, peculiar to man, woman, or child. In my practice, recently I'm observing the short-acting remedies like Helleborus, even belladonna, ignatia, they could cure deep pathological conditions. The remedy is not covering pathology of the disease. So earlier we were thinking there could be n number of possibilities. So if you go through our old books, clearly guide us. It is not the pathology of the disease, basically, it is the uncommon symptoms which guides us selecting the remedy. Next slide. Yes. Hahnemann mentioned, the Kent mentions very clearly, homeopathic physician has no remedy for the name of disease. Homeopathy is an exact science. It is based on natural law, and true physician must prescribe in accordance with the law of nature. Homeopathy has no specific by the name of disease. It has true specific for individual case of disease. So every case we need to individualize. Our philosophy books guide us very well. Next slide. Yes, we have one more case, very interesting case. A 19-year-old male student came. He told at around 8 o'clock he came. He came with like this. He had pain and swelling of the right dorsum of the hand since morning. He told what happened. So morning when I wake up, there was some stench. Nearby room, some honeybees are there. I'd open the window. Honeybee might have bitten, sir. The affected part was red, congested, there was swollen. The skin was very reddish. It has become thin because of swelling, because of stretching of the skin. This was the scenario. And unfortunately, my laptop got switched off. I left my laptop battery in the home. See what happened? I'm more dependent upon laptop. If laptop gets switched off, I become a little bit insecure. Fortunately, I had one software in my mobile. Then he told, then I observed the patient. He said, sir, if since after I'm keeping my hand like this, sir, if I hang down my limb, pain increases. Because of this, I'm holding my hand like this. I'm not able to hang down, sir. If I hang down, my pain increases. The observation was affected part was swollen. When I touched it, it's hard to touch. Any remedy our doctors can think of? Next slide. Yes, I took the rubric. Generals hang down, letting limbs aggravation. We got the remedy belladonna and calcarea. The moment I touched, it was red, hard to touch. That time I was going to theory of chronic disease. Hahnemann was mentioning asoric remedies, antisoric remedies. Calcarea is antisoric remedy, deep acting remedy. Pace of action is slow. The deep acting. Belladonna is quick acting remedy. I thought of giving belladonna because belladonna covered this peculiar modality along with redness, heat, congestion. I gave it belladonna 201 dose. The next day morning when I wake up, there was no swelling. This is the case. And one more thing I forgot to tell. It was 8 o'clock. I had I told him, since my laptop was off, I told him take Apis mellifica 201 dose because of the honeybee bite. He told, since morning I have already taken 2 to 3 doses of honeybee bite, Apis mellifica, but after Apis mellifica, swelling is ascending to the forearm. Generally, I do not prescribe specific drug since I was handicapped because of laptop was switched off. He told, ascending, but belladonna it could resolve. Here, what I would like to convey you here is, if it's a honeybee bite, it does not mean that it is apis mellifica. Cause is not important. To the cause, how does the body uniquely react is important for us. Kahneman tells a weaker dynamic affection is permanently extinguished by the stronger one, whilst differing in kind. So the source need not be the same source. Again, we have to make totality, as very beautifully told by our previous speaker. Next slide. But next time was being absolutely normal. He could not find a swelling at all. And he got very good sleep. After our remedy, if any patient sleep, it's a good sleep, our remedy is right. Because body is in the healing process. And we have one more case. Yes. This was the case, is a chronic case, but it has come for acute complaint. A patient who is around 37-year-old male came to our OPD. His complaint was, just I will tell my experience. Just I was staying in our college hostel. I came down to our hospital. I was seeing one of the interns were taking the case in one of the room. I observed that generally I observe the patients. Generally, every patient I observe their demeanor, body language, how they sit, how they talk. It is nothing to do with disease. It's a unique expression. Just I observed when interview were taking the case. He was taking the case. That man was wearing very bright color shirt, watch with big dial. He was laughing when interview were taking the that little bit extravagant behavior was there. Stylish behavior to seek the attention of the people, a sort of affectation. Some people, they have the tendency to boast, present in a very smarter way to gain the attention of the people. This was my observation. Since a week, he got pain in the lower back and little bit front region, which was left side. The sensation was a sort of locking type, what he was mentioning. Aggravation morning till afternoon. After eating spicy food, he likes spicy food a lot, but aggravation after eating spicy food. Amelioration in the evening. Past history was suffering from left-sided renal calculi. Father died because of MI, maybe at the age of around 63 or 64. Mother is diabetic. One elder sister, apparently healthy. He is a 37-year-old male. Next slide. I asked about the generals. Diet is mixed. Appetite is 3 to 4 times a day. Thirst. I asked, how is your thirst, sir? He told he wanted cold water. One more thing I forgot to tell you. With a little bit old case. When I went to my chamber, I told intern to bring the case, bring the patient. He came. The moment he came, just he entered my chamber and he shook my hands. With smiling face, he entered chamber. He shook my hands. I did not know what is the case. When he shook my hands were cold to touch. There was a cold perspiration. He sat in front of me, sitting with bending backward, the legs restless, legs shaking, smiling face. This was the observation. This I have mentioned in the observation. And also I observed he was sweating a lot, especially the forehead. When I touched the forehead was cold to touch. Here, no patient's concern is pain left lumbar region. He will not tell I get cold perspiration, I get the cold perspiration over the forehead. This has to be observed by the doctor. I asked, how is your thirst? He told, sir, I like cold water. I like cold water, chilled water he likes, especially the freezed water. I asked, what is your desires? The version. It was mentioned that he likes non-veg, spicy things. When he told what you like, he said, I like non-veg, sir, spicy things. He was a little bit proud to tell. Aversion, nothing specific. Micturition 3 to 4 times a day. Sleep, refreshed, lying on left side. Next slide. Observation. He was sitting with bending backward, legs restless. The moment he entered OPD, he shook my hands. Hands were cold. I'm shaking. Wearing good clothes with big dial watch. I asked, okay, where are you from basically? So I'm from Kannur. He told, okay, where is your wife and So my wife and child is staying in my native place. My wife is working in airport. My wife is working in airport. My wife is working in airport. Airport has what? I don't know. Airport, many workers are there. All types of workers are there. A little bit a sort of boasting voice. Next slide. All this has to be observed. No patient will tell I'm a booster. I'm an egoistic person. It has to be observed by the physician. Baran brought up in Kannur, our studies, anger tendency. He was smiling, talking. I told, how is your nature, sir, basically? How was your childhood? Sir, I am basically anger tendency. I am basically friendly. I mingle with everybody. If I get anger, my anger is more. Sometimes I use abusive language. In my workplace, I'm a mechanical engineer. Now I'm staying in Bangalore, Banshankari. Now I'm doing some construction work. I'm one of the engineer. Sometimes if I'm friendly, if sometimes become angry, I start abusing words. I will abuse. Sometimes I may go to the extent of hitting. When he said like this, he was laughing by telling like this. He could enjoy his telling about his nature. He becomes violent. Next slide. Here my observation was boasted, vanity, foppish. Foppish means those people who like very good clothes and at the same time friendly, like phosphorus. Anger tendency, perspiration on forehead. The forehead perspiration was very cold.
Excuse me,
Like-
Shivashankar, how much time you needed?
2 minutes, sir. 2 minutes.
Yes, good.
I will wind up. Perspiration on the forehead, cold hands, desire for cold water, ice cube. I told him what you like. I told him what are your hobbies. Sir, now I'm staying alone here in a room, in a PG. So generally I go once in 2 to 3 days pub. Generally I will have non-veg food. I like whiskey or rum, or even the hot drinks. I like ice cube. I have to put 3 or 4 ice cubes to drink, such scenario. Next slide. Characteristic particulars for left side of the back pain, laughing type of pain. Next slide, sir. The remedy was clear to me. For me was affectation, foppish, vanity. The remedy was clear to me was Veratrum. Now I prescribed the Veratrum. Now I saw the last page. Yes, when I saw the last page, BP. Once we check the BP once again. Check the BP. To my astonishment, BP was 210/120. This patient had been to 5 days back to the orthopedician. Orthopedician has given some painkillers. He told your BP is a little bit more. You come for follow-up after a few days. Again, we'll check the BP. If you really require hypertensive or anti-hypertensive drugs, we'll prescribe. Now a dilemma came to me. His BP is 210/120. If I prescribe that drug, if anything happens, then blame will come to me. What shall I do? But the case presented peculiar symptoms. Whenever case presents qualified mentals, qualified physicals, we did not fear. I took a chance because case was clear. I gave the remedy Veratrum 101 dose. It was Friday evening. I told him to come after next day evening. The next day, Saturday evening, he came with smiling face. Sir, I am feeling 60% better in my pain. When we checked the BP was 190/120. He was feeling better. I told him, sir, come after 2 days. Again, we'll check the BP. I had given only PL. He told him, sir, tomorrow I have party. Shall I go for the party and have drinks? I told him, no, sir. You have a little bit. Please wait for another 1 week. Do not do any party. On Monday evening, he came after 3 days. When we checked the BP was 170/90. After 2 months, the patient stopped coming. After 2 months, I called him. How are you, sir? He told my BP is 140/90. I'm doing well. Now I am consulting my regular physician. This was the case. Here, though the BP was 210/120, since the case presented very well, qualified mentals, qualified physicals. If we get qualified mentals, qualified physicals, peculiar symptoms, we can make an attempt to treat them diseases.
Okay.
I would like to summarize, sir.
Yes.
Yes, sir. This was, yes, sir. These are the 4 cases.
Yes. We want the discussions, so it's time for discussion. Those who would like to participate can go to the participant list and raise your hand. It was a nice presentation, absolutely a professional one. And it again proves that the relevance or the importance of the Hahnemannian science, what he told, what he studied us. Yes. And of course, the first person to respond is none other than Sridhar Group sir. Yes, sir, please. Sridhar Group sir, please unmute.
Yes. Doctor, it was very nice, excellent presentation. A big salute for you. I am remembering Dr. Rastogi was using the Morninghausen repertory, and he was giving excellent result after using Morninghausen's repertory. Thank you very much. Come again with such a very good class. Thank you very much. Your all expressions, voice modulation, examples, and everything, case records are very excellent. Thank you very much.
Thank you, sir. Thank you.
Yes, that's a correct observation. Moreover, the body language is also very important. It's a total involvement, I can say. That's the most important thing. As well as he referred a lot of older works from Hahnemann. That's the most important thing, most interesting one. In recent days, nobody is bothering about that. That's also important. Then about the fragmenta de verbis medicamentorum positive sive insano corpore human observatis. Is the full name of the textbook. But everybody is always in fragmenta de verbis. Fragmenta de verbis medicamentorum positive sive insano or corpore observatis. That is in the case of healthy human being. This is a text, this is a original textbook. Nice work. Then again, what about the case taking in each and every case of disease? That makes a big difference. You can't see such a description in Hutchison's textbook of this clinical medicine or any other textbook of medicine, the Krishnadas medicine. So there is no such reference, no such mentioning. Case of disease is different from disease. That we should understand, we should perceive. Then another fact is, what is curative medicine? That is also makes a big difference with homeopathy, with other medicines. What is curative in each and every in every medicine means the indication, the symptoms proved by that medicine. Then another important thing, I think, the case of the lemonade, warm lemonade, I think pulsar is around medicine. That may be this one, if my memory is correct. I think in the Ken's repertory or somewhere, it is always using warm lemonade. It's quite different because pulsar is always preferring cold drinks. But in the case of lemonade, it prefers warm drinks, warm lemonade. Just another thing. Then another, meanwhile, it's time for discussion. Those who would like to participate, please go to the participant list and raise your hand. Then another thing is you mentioned about is concomitant. It should be observed. That's a good suggestion. Well, everybody speaks about the concomitants from the patient's words. But what is more professional, more correct is our observation. And again, that too, especially when the patients are, there is a lot of the more educated persons. They will not express themselves. They will always express in some modified form. Very polite, very passionate. But in fact, the fact was just the opposite. They were very rude or violent. We can't understand that. That's another thing. Anyway, that's a nice presentation. Then about the cause. Somebody asked in the chat box why the cause was not considered. Yes.
The cause,
Yes.
the cause section in our Metamedica and report is a clinically verified section, sir.
Pardon?
It's a clinically verified section.
Yes.
Suppose in the ailment from vaccination, you see many children, if they're weeping, moaning, if they're thirstless, you give pulsatilla totality. If you see frequently pulsatilla, you can also add the remedy pulsatilla in the repertory. All the ailment from section in our repertory are ailment from domination, all ailment from mental ailment, physical ailments. What Hahnemann tells, ailment from caring for others or worries, or even all these are clinically verified sections. That section is an open section. We can add the drugs.
Yes, doctor, but the logical thing is that why you give arnica for injury, for this trauma? What is the logic? Because when you prove arnica, the patient will produce symptoms that is very similar to injury. That is the reason. There
Yes,
is
sir,
no
yes,
other
sir.
relation between arnica and injury. What is the relation? Only symptomatic. Then in the case, you gave this, at first the patient took a piece. That is not relieved. But the patient has got more characteristic symptoms than the piece. That is why you gave belladonna and it worked.
Yes,
So that is a logic of homeopathy. It always
sir.
similar in manifestation but different in kind.
Yes.
Have you
Here,
noticed that? Did you
after
notice that in
ailment
the
from
first?
fall, after ailment from fall or blunt injury,
Pardon?
sir, if arnica fails, we say ruta is the remedy.
Yes.
One of my students had fell from the bike.
Yeah.
She had got pain in the lower limb, so she had taken arnica. She was not doing well. When I went to the classroom, she was raising her leg on the table. She was putting leg on the table. She told sir, I'm not able to put down my leg. I took the rubric, raising limbs amelioration, Ruta was there. I gave Ruta 30 few doses. She did well.
Yes.
The thing is, sir, again the modality here. If arnica works very well, if there's a fear of being touched, the modality and concomitant matches well, arnica works well.
Yes. Yes, that's an important thing because we have different methods.
Correct.
Yes, to find out the similar medicine.
Yes.
It should imitate in different ways. It can be. There are possibilities. That is why Dunham, I think, he says that this is all this happened because of the elasticity of nature's law.
Correct.
That is why we are all surviving, even though we are practicing different way. This way, that way, this Hughes way, or a pathological prescription, polypharmacy. But everybody got result because of this quality of homeopathy. The quality of our medicine, the quality of material medica, this happens because of our masters, not because of our ability. That's my suggestion. Yes. Dr. Gurugiran, what is your opinion? You must
Yes,
have
sir.
words. Definitely, we would like to hear from you. Yeah.
It's a very nice presentation. I've been observing since my college days. He's a very hard worker, dedicated homeopath. He works a lot behind each and every case, as we all seen by 1 hour. And all the things he put into his positions by reading a lot of literature, especially
Yes.
the older literatures, the treasures of homeopathic literature.
Exactly. That word is the most suitable word.
Yes.
The treasures of the literature, and I'm very happy to see because in these days everybody is looking for shortcuts or Google searching. Nobody's reading proper books.
That is where the truth lies in the homeopathy.
Yes.
In the previous literatures.
So it must be enjoyed. The reading of our masters for great works. You must read and again the organ of medicine, the materia medica, the chronic diseases. Definitely, we can find more and more meanings, more and more findings. Each and that is the most wonderful thing in the homeopathic materia medica. Then another thing, why Hahnemann gave this word fragment? That we must think. Such a concept is not at all adopted by the medical science in the present day. You know what happened? The CQ had this medicine for COVID. Then they just put that medicine in the market and declared this is the medicine. But at the same time, Hahnemann, he is very honestly, you are sure about the quality of medicine. He declared that these are only fragments. That's the difference between the Samuel Hahnemann and the present day the medical science. Now, Hariharan sir, yes sir, you can take a few minutes also to express auto thanks also, sir. Definitely, you will be very pleased. Yes, sir, please.
Okay.
Another very talented person we met today. Yes.
Okay, doctor. Your classical prescription is very nice and good.
Thank you, sir.
See, sometimes the patient comes to us
Yes, sir.
with the exacerbation of the chronic disease. That cases, how will you prescribe?
Yes, sir. When whenever a patient comes to exacerbation of chronic disease, sir, we have two possibilities, sir. We have two possibilities. Many times, patient has come for the first time. He's suffering from asthma or he's suffering from chronic headache. Now he has acute exacerbations. Now he has come. One of the acutes are one of the positive point is, sir, the qualified mentals, the mental symptoms, the qualified physicals, which were probing after the presenting complaint, like physical generals, mental generals, those unique expressions come on the surface. More the crisis, peculiar symptoms more come on the surface. What we need to take 1 hour case or 45 minutes, in acute exacerbation, we see the qualified mentals, qualified physicals come on case. We can in 10-15 minutes only, we can make one totality. Often constitutional remedy only will come. Possibility one.
Correct. Appreciation. Very correct. Very correct. Very, very correct. Appreciating you. Appreciating you.
Without it will come on the surface. Second possibility is in acute exacerbation, disease has localized in one organ. New modality has come.
Correct.
New modality has come. The chronic remedy, the mental generals, physical generals, not covering the intense locations or modality, we can think of an acute short-acting drug, like what, like Bryonia, Ruspox, short-acting drug. We can give like asoric remedy. Later we can give constitutional remedy. Both possibilities are there, sir.
Yes, okay. Yes. Sir.
Okay, doctor. Thank you very much for IFPS partners and IFPS. See, I like to congratulate you. Come again in our platform. Thank you very much. Good night.
Thank you, sir. Thank you.
Well, another important thing is there is some mishaps. Among the mishaps that happens during the treatment of chronic disease, you can see a lot of discussion by Samuel Henneman, around 20-30 medicines. That's very important in chronic disease. So with that remark, let me conclude today's English edition. Hope you to meet the same day tomorrow. Till then, goodbye. And all Dr. P.K. Shaya to continue the program in Malayalam.
Thanks.
Yeah, doctor.
So thank you, sir.
Dr. Manoj. ഇന്ന് IFPHന്റെ 1009-ാം ദിനമാണ്. നമ്മൾ ഒരു ഇംഗ്ലീഷ് സെക്ഷനിൽ നല്ലൊരു ക്ലാസ് ആയിരുന്നു എന്ന് അതെല്ലാം കേട്ട് കഴിഞ്ഞ് നമ്മൾ മലയാളം സെക്ഷൻ ആരംഭിക്കുകയാണ്. ആരംഭിക്കുന്നതിന് മുമ്പ് ഈ IFPHന്റെ 1009-ാം ദിന പരിപാടിയിൽ പങ്കെടുക്കാനായി എത്തിയിട്ടുള്ള ബഹുമാന്യരായ ഡോക്ടേഴ്സ്, ഹോമിയോപ്പതി ലവേഴ്സ്, സ്റ്റുഡൻസ് എല്ലാവർക്കും ഈ ഇന്നത്തെ പരിപാടിയിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. ഇന്ന് നമുക്ക് ക്ലാസ് എടുക്കാനായി എത്തുന്നത് ഡോക്ടർ PS നിത്യ മാഡത്തിനെ കുറിച്ച് പറയുകയാണെങ്കിൽ ഡോക്ടർ ഇപ്പോൾ ആയുഷ് പ്രാഥമികാരോഗ്യ കേന്ദ്രം മാറാനെല്ലൂർ മെഡിക്കൽ ഓഫീസറായി വർക്ക് ചെയ്യുന്നു. BHMS, PG in counseling, കേരള യൂണിവേഴ്സിറ്റി നിന്ന് ബിരുദം എടുത്തിട്ടുണ്ട്, PG എടുത്തിട്ടുണ്ട്. അതിനോടൊപ്പം പ്രോജക്റ്റിന്റെ നോഡൽ ഓഫീസറായി വർക്ക് ചെയ്തിട്ടുണ്ട്. പിന്നെ അഡോളസെന്റ് കൗൺസിലിംഗ് കൺസൾട്ടന്റ് ആണ്. അങ്ങനെ ഒരുപാട് കാര്യങ്ങൾ കൈകാര്യം ചെയ്യുന്ന ഡോക്ടറാണ് നമുക്ക് അതിഥിയായി കിട്ടിയിട്ടുള്ളത്. അതുകൊണ്ട് തന്നെ നമുക്കറിയാം ഡോക്ടർക്ക് ഒരുപാട് കാര്യങ്ങൾ നമ്മളോടൊപ്പം പങ്കുവയ്ക്കാൻ കാണും. ഒരുപാട് അറിവുകൾ നമ്മളോടൊപ്പം പങ്കുവയ്ക്കാനായാണ് ഡോക്ടർ എത്തിയിട്ടുള്ളത്. ഈ നമ്മളോടൊപ്പം എത്തിയിട്ടുള്ള നിത്യ ഡോക്ടറെ IFPHന് വേണ്ടി ഇന്നത്തെ ക്ലാസ്സിലേക്ക് ഞാൻ സ്വാഗതം ചെയ്യുന്നു. ഡോക്ടർ നിത്യ, സ്വാഗതം.
ഡോക്ടർ ജോയിൻ ചെയ്തിട്ടില്ല, ഇപ്പൊ ജോയിൻ ചെയ്യും. ഞാൻ വിളിച്ചിരുന്നു. അപ്പൊ ഡോക്ടർ പറഞ്ഞ പോലെ ഇതിനകത്ത് പങ്കുവയ്ക്കില്ല. അതെ, സ്വപ്നങ്ങളൊക്കെയും പങ്കുവെക്കാം, ദുഃഖഭാരങ്ങളും പങ്കുവെക്കാം, അങ്ങനെ എല്ലാം പങ്കുവെക്കാവുന്ന ഒരു വേദിയാണ് IFPHന്റെ പ്രത്യേകത അതാണ്. അപ്പൊ അതുകൊണ്ട് തന്നെയാണ് പല കോണുകളിലും ചില വിമർശനങ്ങളും ഉണ്ടാകുന്നുണ്ട്. അപ്പൊ എനിക്കൊരൊറ്റ ചോദ്യമേ ഉള്ളൂ. കഴിഞ്ഞ ഒരാഴ്ചയായി IFPH നടത്തിയ പ്രോഗ്രാമുകളിൽ ഏതാണ് ഹോമിയോപ്പതി പ്രിസ്ക്രൈബ്ഡ് ക്വാളിഫൈഡ് അല്ലാത്ത ആരാ എന്താ പറഞ്ഞത്? ഒറ്റ ചോദ്യമേ ഉള്ളൂ. ഇത് കേട്ട വാദി കേൾക്കാത്ത വാദി പലരും ഉള്ളത്തിൽ ഭയമേറുക മൂലം വെള്ളത്തിൽ ചിലർ ചാടി ഒളിച്ചു, മണ്ണിൽ പല പല കുഴിവുണ്ടാക്കി പൊണ്ണന്മാർ ചിലർ അവിടെ ഒളിച്ചു എന്നുള്ളതിൽ പോവുകയാണ്. ഒന്ന് ആലോചിച്ച് നോക്കുക. അതിപ്പോ നേരത്തെ പറഞ്ഞ ആളെ ഹോമിയോപ്പതി MD ഉള്ള ഒരാളാണ്. ഇപ്പൊ അടുത്ത പ്രസന്റ് ചെയ്യാൻ പറഞ്ഞത് BHMS കഴിഞ്ഞിട്ട് സൈക്കോളജി MSc ഉള്ള ഒരാളാണ്. അപ്പൊ ഇത്രയധികം ഹൈലി ക്വാളിഫൈഡ്. ഇനി നിങ്ങൾ ഇന്റർനാഷണൽ ലെവലിലേക്ക് നോക്കൂ. ഇതിനകത്ത് പങ്കെടുക്കുന്ന ആരാണ്? കാർഡിയോളജിസ്റ്റുകൾ, ന്യൂറോളജിസ്റ്റുകൾ, നെഫ്രോളജിസ്റ്റുകൾ, പീഡിയാട്രീഷ്യന്മാർ തുടങ്ങി ഗാലക്സി ഓഫ് ഫിസിഷ്യൻസ് ഫ്രം ഡിഫറെന്റ് പാർട്സ് ഓഫ് വേൾഡ്. അത് സാധാരണ ഒരാൾ കിട്ടുന്നതല്ല. അപ്പൊ നമ്മുടെ ഡോക്ടർമാരുടെ ആ ഒരു ഉന്നത തലത്തിലുള്ള കോണ്ടാക്ട് കൊണ്ടും കൂടെയാണ് ഹോമിയോപ്പതി നിലവാരത്തിലേക്ക് എത്താൻ കഴിയുന്നത്. ഇനി വേറൊരു വശം പറയുകയാണെങ്കിൽ ഇതിനകത്ത് സഹകരിക്കുന്ന ആരാണ്? ഏറ്റവും ഉന്നതമായ നിലവിലുള്ള അത്ര തന്നെ പറയാൻ PRS ഹോസ്പിറ്റൽ ഉടമസ്ഥൻ ഡോക്ടർ മുരുകൻ ആണ് കഴിഞ്ഞ ദിവസം നമ്മുടെ ഇതില് വേദിയിൽ വന്നിരുന്നത്. മുമ്പ് കിംസ് ഹോസ്പിറ്റലിന്റെ തലവൻ ഇതിനകത്ത് വന്നിരുന്നു. അതുപോലെ തന്നെയാണ് നിംസ് മെഡിസിറ്റിയുടെ. എന്തിനാ വരുന്നത്? ഹോമിയോപ്പതിയുടെ സാധ്യതകൾ കണ്ടെത്തി അവിടെ ഹോമിയോപ്പതിയുടെ വിങ് തുറന്ന് പഠിച്ചിറങ്ങുന്നവർക്ക് ഭാവിയിൽ ജീവിതത്തിലേക്കുള്ള വഴികാട്ടി കൂടിയാണ്. ഒരു സാധ്യത ഉണ്ടാക്കാൻ വേണ്ടി IFPH പാടുപെടുന്ന, അല്ലാതെ ഈ പറഞ്ഞ കണക്ക് അമിതമായ അറിവുണ്ടെന്ന് സ്വയം വിശ്വസിക്കുന്നവർ പറയുമ്പോഴല്ല, ഭാവി തലമുറ കണ്ടുകൊണ്ട് അവർക്ക് വേണ്ടിയാണ് പ്രവർത്തിക്കുന്ന. ഒരിക്കൽ കൂടി ഓർപ്പിക്കുന്നു. നമ്മുടെ ബഹുമാനപ്പെട്ട ഗസ്റ്റ് എത്തിയിട്ടുണ്ട്, ഡോക്ടർ നിത്യ. ഒക്കെ തുടങ്ങിക്കോളൂ. നമ്മള് സ്വാഗതം എല്ലാം പൂർത്തിയാക്കി തുടങ്ങിക്കോളൂ.
നിത്യ ഡോക്ടറെ ഒരിക്കൽ കൂടി സ്വാഗതം ചെയ്യുന്നു. ക്ലാസ് തുടങ്ങാം.
അൺമ്യൂട്ട് ചെയ്യണേ.
കേൾക്കാമോ സാറേ?
കേൾക്കാം.
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 ഓക്കെ
കേൾക്കാം.
ഓക്കെ.